So if we want to look at the benefits of exercise in persons with asthma, once again, exercise typically makes their asthma a little bit better. It reduces the residual volume so that there's a lesser amount of air trapped in their lungs. And as we talked about in the beginning, asthma is considered a form of COPD because you do have air that gets trapped in the lungs. They have smaller disturbances in their respiratory physiology, so overall they're more stable. They may go to a higher intensity before they get an asthma attack. And also, they should exercise for social support and less stigma. When I was growing up, kids were told, if they had asthma that they should not exercise. So many of these kids never really developed sports or fitness skills because they were told it wasn't safe. But that's really not the case. So kids with asthma can be included in many activities, and they should. So, if someone has asthma that's not stable, they shouldn't exercise until they've gotten over their acute attack, or if they're having, for some reason, their asthma is getting worse. Once again, make sure they have their bronchodilators, their inhalers with them. And the other medications sort of help make the management of asthma much better. But you have to be careful if people are using prednisone on a long-term basis. And this goes across many special populations where prednisone is a common medication that they take. It does tend to cause muscle wasting. So we really do want to make sure that they're doing resistance training. Prednisone also reduces bone density. So we really want to, once again, make sure they're doing resistance training. Cold, we talked about that. Watching out for those cold environments, those high pollution areas, high intensity if someone's maybe not done a long warm up. The one good thing about our rainy summer is that the rain has washed away a lot of the pollution. We didn't have many high pollution days. I don't think we had one this summer. So bad news about the rain, but good news for people who have respiratory conditions. The inspiratory muscle training, like we talked about in the previous class, these don't really seem to benefit them like they benefit people with the other types of COPD, like emphysema and chronic bronchitis. So now let's shift gears and talk a little bit about cystic fibrosis. It's not a very common disease. You can see it's only 1,000 cases in the U.S. each year. It's a genetic disease. It's a particular type of protein. And although most of us are probably familiar with it affecting the lungs, it does affect other organs, the pancreas, the intestines, and sweat glands. So people who have cystic fibrosis produce a lot of mucus that clogs their lungs. They have an abnormal secretion of pancreatic enzymes, and they have a very high salt concentration in their sweat. So it is a very serious disease. The life expectancy is typically only 30 to 40 years. Most people need to have at least a single or double lung transplant in their adulthood if they want to have any chance of survival. Symptoms of cystic fibrosis: it's very intense cough, wheezing, mucus, frequent respiratory infections, as they mentioned, typically diagnosed in early years, gastrointestinal obstructions, a concept called failure to thrive. So that is a child that is very, very small for their age. They're thin. So when, children are not really following those growth chart curves, if they're way, way below, we talked with obesity that they're 95%. We're looking at kids that are maybe 5% of the percentile. So they're consistently very small. They're not growing. They're usually very thin. They don't have the ability to digest fats, so they tend to not get absorbed. And they really do have a salty taste on their skin from their sweat glands. Complications seems to make sense. Repeated lung infections. So kids with cystic fibrosis, young adults, they are sick all the time, coughing up blood. They can develop high blood pressure in their lungs, which is known as pulmonary hypertension. So that causes damage to the lungs, and that's one of the things that tends to lead to them needing a lung transplant. They can have heart failure on the right side of their heart as a result, because that is where the blood goes from the right ventricle out to the lungs through the pulmonary artery to pick up oxygen. So cor pulmonale, their lungs are hyperinflated as well. They have a high residual volume, similar to other people with COPD. Atelectasis, they can get collapsed lungs very easily. They can get a pneumothorax, and they can have respiratory failure.